Okay, this is a patient of mine I've done a previous lipo and tummy tuck on, and I want to kind of answer a few questions about internal fat. And so I thought, you know, we're gonna do a breast reduction, but I thought it was a good time to kind of answer some questions, or at least address some issues about internal fat. And so one thing that really stands out when you look at her abdomen, she's got a beautiful shape to her abdomen, but you'll notice that her abdomen kind of scoops in a little bit. And this is really, really pretty. And the reason why this scoops in like that is because she just doesn't have any internal fat. And that's just absolutely fantastic. And I'm gonna turn you sideways. And this is why I'm always going on about the internal fat, because look at how thin she is. And so once I remove that skin and I tighten the muscle, then she's nice and flat, and she's even actually scooped in here, which is absolutely just beautiful, but it's because there's no internal fat. And so that is really a good example of what happens when you remove the internal fat, and we're not fighting it when we do a tummy tuck. Now I'm just gonna just lower your underwear just a little bit. We'll just look at her scar. She's 1 year out. So all of the stretch marks that were below her belly button went away, but these stretch marks here were way up high, and so they get moved down. But here's her scar. She's healed really nicely. And people are always worried about the scar. I think, for me, in my opinion, trading a really nice flat abdomen for a scar, it's a good trade. And you can see, just lift up your underwear again. If you can see, they're covered with her underwear. So now the scar is concealed, and you get a nice flat abdomen anyhow, and a nice looking belly button. So that's kind of one thing I wanted to address with her tummy. Now we're going to do a breast reduction today, and I wanted to show you something, because this happens all the time. And kind of show me what you were showing me before, how you wanted your breast to look.
Muéstrale como tú le dijiste cómo querías tu seno.
Yo lo quiero así.
Okay. No, but this is really interesting. So, and that's pretty. That looks really nice. Go ahead. Do that again. Don't stop. Okay. But here's one thing that I really wanted to show you. And she's not doing it as much now because I kind of told her. But before, she was sort of pushing her breast in like this. And this is what patients want, is they want a more narrow breast. But the problem is that her breast, just stay straight, her breast is actually really wide. And so one of the things and let's look at the other side. One of the features about a breast that I cannot change, you know, I can make the areola smaller, I can position the areola higher, I can make the breast bigger with an implant, I can make the breast smaller with a reduction. But one of the things that I cannot change is the width of the breast. And so we see here that her breast, and no te muevas, her breast is right, it stops about right here. And so if we look at that distance across here, you know, I'm going to turn here, it's about there. You know, that's how wide the breast is. And that is a fixed dimension that I cannot change. So a lot of times patients will say, well, I just want to be, you know, like this. And I totally understand, I get it. But I can't do that with a surgery. I can't narrow the breast, just like I cannot move, you know, her eyeball. It's where it is. So what I can do is I can lift the breast, I can make her breast smaller, but this here will never change. This width will never change. And so I think that's important to understand when you have a wider breast and you're looking at having a reduction or a lift, that we can't do that. And I know people want it because this type of breast, when it's here, you feel it in the bra, patients sometimes feel it in the arm, and it sort of sticks out and bothers patients. And if a breast is wider, it doesn't look as good as if a breast is more narrow. And so, but that's just reality. So I think it's something super important to understand. There's a fixed breast width, and we're going to work within that fixed breast width to make the breast higher, and I'm going to give her better shape. And we're going to make her breasts a little bit smaller. She'd like them a little bit smaller. But you know, there's an advantage of doing a reduction, and when you do a reduction, it already comes with a lift, but just getting her breast off her chest, you know, off her upper abdomen is going to be a huge change for her, especially when she has such a beautiful, nice look to her abdomen. It's nice to show it off. This almost, having her breast in this position almost makes her look, you know, a little bit heavier really than she is, because she's so thin. So I just wanted to point out those couple of features, and she's a really nice patient. In fact, I don't know why, she makes me laugh all the time. I don't know why. I don't know how I'm going to do the marking. But thank you, I really do appreciate it.
Thank you for your good work.
All right, thank you.